Hey, I'm Dr. Matt Nejad, and I practice biomimetic and aesthetic dentistry in Beverly Hills, California, and today I want to tell you a little bit about why I started lecturing. I graduated in 2010, and when I started dental school, I was actually really interested in doing the business side of dentistry, owning multiple offices and all those things, but I came across one of my mentors and my current mentor, Pascal Monnier, and he really changed the trajectory of my career. When I saw him speak, when I saw the type of dentistry he does, I became very passionate about doing really high-end, precise dentistry known as biomimetic dentistry. And having learned that, I knew I wanted to practice that way. But what I didn't realize is how special and unique it was for the time. And when I graduated, he gave me the opportunity to present a case I had worked on with him as a student. So I presented the first time, my first year out of school, to a group of about 300 dentists. And that got me started. I really loved it. It made me excited to present and even improve the type of dentistry I do. So I naturally started doing more and more after that time, and before you knew it, I got to doing it consistently every year. Fast forward a couple of years after I did my first lecture, I started putting together courses, and these courses were intended to train dentists in biomimetic dentistry, because even though I learned a lot of these things in dental school, there wasn't a lot of other dentists practicing this way at all, and that was a big surprise to me. But also there wasn't a lot of dental schools training this, even though USC was training that, and that's where I went to school. There wasn't a lot of dentists that were graduating practicing that. I would hear other people say things like, oh, you know, we only do amalgam or crowns on posterior teeth, composite restorations don't last. So I felt really compelled to not only show what I do, but really spread the research, the science, and the techniques that allow for conservative restorations. And I started doing courses, and that eventually turned into a full-on institute where now you can take courses online. There's an online access period, there's live mentoring and demonstrations, there is office hours for questions, review, and we offer courses pretty much every month. On YouTube, I'm trying to put out everything from my philosophies. I show some techniques like immediate dentin sealing. I also put content out for patients, because I try to put educational information that both helps dentists, but also a similar topic, but kind of created for patient education so that patients can learn about it. And I find that's really useful, because patients who are really interested in getting dentistry that's conservative, avoiding crowns, preventing root canals just because a cavity is deep, and so on, it's one of the most impactful things that we can do, or that I feel like I can do, is to help spread that information and show that information. So that's the type of stuff I'm putting on YouTube. On social media, I was really resistant to doing social media originally. I thought, just a website was all you needed, and I put all my energy into that. But then I just realized social media is such a powerful way to share information, again, with colleagues and dentists. So what I show on there is a combination of my restorative cases, the before and afters, some insight into the techniques I use, especially on the Nejad Institute version of my Instagram, where I kind of focus on more the science. It's, again, intended for dentists, whereas my main Instagram is really tailored for patients interested in cosmetic work, showing them before and after, but also educating them on the importance of isolation, rubber dam, what the difference in quality is. I really try to always make my content educational and informative, and really show that the type of work we do is very multifaceted, where the bond is not something that you can necessarily see on the surface, but it makes a huge impact on how long something lasts, how durable it is, and it's a huge thing for patients to understand when making a selection on their dentist or the procedure they want to get done. If you're ever interested in taking a course, you just go to nejadinstitute.com, and the courses are really focused on biomimetic and aesthetic dentistry. Right now I'm offering level 1 and level 2, which is restorative dentistry with the biomimetic approach, and it progresses from the foundation and techniques, which are covered in the first level, and then it goes into the advanced techniques, even more science, and even more mentoring with me, with a longer subscription of 6 months that allows time for questions, answers, interactions, case studies, and so on. These courses used to be in person, and a lot of people are very concerned about online format right now. But what I've actually found through the process is that the online format has a lot of huge advantages. So for one, you can rewatch the videos numerous times. When you take level 1, you have 30 days of access, and there's a live office session where you can ask questions. We get on Zoom and talk about any questions, even share case studies or answer any questions you have about a case. So you have 30 days to watch those videos, rewatch them, etc. Then for level 2, you get access to everything you took in level 1 again, plus all the new content. So it's another way to review things. Now you have 6 months of access. And what people have told me is they really enjoyed the ability to watch the videos again, go back, reference things. They didn't feel that rush to write down a bunch of notes because they knew they could go back and rewatch sections. There's quiz questions that really test your ability. There's case studies that help you look at how different cases are approached. So overall, the feedback has been really in favor of the online format. And I really try my best to make sure that I give individual attention as much as you need. So if you're emailing or putting questions on the message board, I'm always there to help people that are taking the course. And I think that there's a lot of benefits to this online format.